Hi, my name is Carrie Kerr, and I'm here with my son Julius Kerr, who is going to use the interview questions that you guys sent me from Dr. Lee's class to answer some questions you have regarding early childhood development and speech language. So go ahead and ask me the first question.
Please tell us about your educational background, including why you decided to become a speech therapist.
Okay, so my educational background is in speech language pathology, which is now referred to as communication science disorders. I have a bachelor's degree and a master's degree from Illinois State University, and I also have a certificate in special education advocacy from William and Mary Law School. So that is the essential background of my education. Um, and why I decided to become a speech therapist. I was very interested in helping children with disabilities and originally thought I wanted to be a special education teacher. Um, and he's directing me to the camera. I originally thought I wanted to be a special education teacher. My mom encouraged me to consider speech pathology. She let me know that it was very specialized and I had a lot of options of what I could, how I could use that education, whether it was part-time work, full-time work, private practice. And as it turned out, even though I didn't listen to my mom about a lot of things, I did listen to her about that. And I appreciate her advice and guidance to going towards speech therapy.
Tell us about your professional experiences from the time you became an SLP up until now.
Professional experiences. So that's kind of a long list because I'm getting old. So I graduated in 1997 with my master's degree. So it's been 23 years now. Um, and really 22 years. But anyway, it started off in private practice briefly, and then I actually had my first child and stayed home with my kids for a long, long time. During that time, I was a homeschooling mom, and I really dove into educational philosophy during that time. And of course, as a speech pathologist, I was very interested in child development, and it was great to study my own kids' speech and language development. So I enjoyed just that phase of life and mastering normal, typical language development with my own kids, and then eventually carrying that over to some curriculum development that I did working from home while I was homeschooling the kids. I also did a lot of freelance writing and some presentations for child development organizations, daycares, that kind of thing, on what is developmentally appropriate behavior and expectations. Um, and so that was kind of some of the experience I had. I actually did some online live classes back then for homeschoolers, which is really interesting because that ended up giving me some groundwork for this need right now during COVID-19 to do live class teaching. So it's funny how some of the things you do on the sidelines throughout your career end up being valuable skills as you advance. So all of those experiences, whether they were homeschooling my kids or doing direct therapy, or even doing publishing for curriculum development, that all helped me become the specialist I am now. As my kids started to get older, I went back to work. I went to Easter Seals to be a speech pathologist with them. And that's when I met Dr. Lee and we started doing some research together. And she was a great mentor for me and actually just a great cheerleader. She always encouraged me. So I so appreciated our time together doing some research on parent coaching and parent therapist child triad type of programs. So she and I had a lot of fun working on that and presenting that at some international conference and state level conferences together. Um, and from there, I also worked on presenting at some other conferences in augmentative alternative communication specialty, which was really where my area of focus was for kids who are low or nonverbal. So I presented at Closing the Gap and Illinois State Speech Hearing Association, and some local, like our local speech language hearing association and some school districts. So that's basically been my area of expertise, is early childhood development, augmentative alternative communication, and parent-based intervention, really through parent coaching.
What are some of the current speech language practice models you find are most effective based on the evidence from your own practices?
So that's a great question because it's very important to understand what evidence based practices are and how they relate to the population that you're actually working with. Um, Evidence based practice is a word that's thrown around a lot, and I think it's really important to remember what that means when you're looking at the evidence. Who's that evidence about? So I went to a conference this past winter where it was like a crash course in reading research, and it's something we learn in college and graduate school. How do you read research? How do you understand what is statistically relevant? Um, what is the methodology? What were the results? Who was the sample? What was the control? All of those things that we learn in graduate school, that as you get older and get into actual practice, you kind of hear like, oh, evidence says, research says, and it can be easy to just follow that path without really knowing if whatever evidence out there or research out there is actually applicable to the population that you're working with. So this little crash course that I had with at this convention I went to reminded me of how important it is to read the evidence, the research that you're referring to. Does it refer to the population that you're working with? Does it what were the results? Are those results applicable to the particular clientele that you're working with? So I think evidence based practices, it's really important to know what you're talking about when you throw around the words evidence based practice or research methods. Know what you're referencing. And if you're referencing evidence or you're referencing research, be able to really point to what evidence or research you're talking about. Otherwise, it might not be valid. And so I think what I use the most is that parent coaching method because I do work with that population that's very young, 0 to 3 is early intervention. We see a lot of those kids. We also see kids who are 3 to 9 here in the clinic, a little bit older, but we have those early developmental years. It's the family that makes the biggest difference in the child's development. And there is a lot of research out there, and some of it is research that I did with Dr. Lee on the importance of parent based intervention models and how effective is that. And so that is what I've used the most. And what's interesting is that with the new teletherapy that we're right now on quarantine and we can't do direct services, the methodology we're encouraged to use for teletherapy is parent coaching, and that's been super easy for me to implement, and it's been very effective in helping our little ones make progress even though we can't see them face to face. So for me, that's probably what's closest to my heart, is understanding parent coaching regardless of what the intervention need is that I'm focusing on for the child.
LENA studies strongly suggest that parental word counts correlate child's language development, including children with disabilities. What are your recommendations for parents and early childhood teachers?
That's a great question, and I love those Lena studies. Yeah, actually, I was just on a therapy session today with a family, and I referenced the importance of the language modeling, and it was directed towards a family who's using augmentative communication with their 2-year-old. We have the 2-year-old using eye gaze technology. If you don't know what that is, you might want to take a chance to look it up. But the child uses their eyes to access a communication device, and that's the way they're going to speak. So this little girl, she is quadriplegic. She has a lot of impairments. She's going to be used a lot nonverbal communicator probably for the unforeseeable future. And so we're starting her very young on eye gaze technology to communicate, and she's doing great. In that she's able to access it. She's starting to play games on it. She's able to access a couple of word selections, but she doesn't necessarily know what those words are yet, right? So we're modeling hi and bye and feel and look, those kinds of words, like core language words. And how do we teach her how to use this communication device? And I explained to the mom that the average child, by the time they reach 5 years of age, has been introduced to or immersed in X amount of words. I don't remember how many they were, but by the time they're 5 years old, they will have heard X number of words. For a child who uses augmentative communication, it takes 82 years for that child to be exposed to the same number of words because nobody's modeling for them in their own language system. And so when we speak to children, we're modeling their actual language system if they're a verbal communicator. If the child is a nonverbal augmentative communicator, we have to model for them that same kind of Lena study where we have to expose them to that language using their own language system. So if you want your child to use the word look or go or stop or help or come here or eat or drink on their communication device, you also have to also be using that communication device to model for them how communication works in their language system. And so modeling is super important. The research out there, and be able to quote what research that is. So, for instance, the 30,000 or 30 million word gap, which uses that Lena technology, really gives the example of how important it is to model language all day long. It is a parent coaching model, so we go back to that evidence base of what methodology do I like to use. I like to use the parent coaching because it's very effective. And the number one thing I tell parents to do in order to achieve that is to read books. Read books daily. If anybody's been interested, I've been reading books to my farm animals and posting them on livingacademics@gmail.com because I don't have any little kids to read to right now. And reading is so, so important because that's where our kids are exposed to language. So whether it's reading with the kids at home or me reading to the kids with my farm animals and putting it on YouTube, however we can expose kids to language, that's what's going to help them fill up their word bank so that they can become successful learners.
What are your thoughts on enhanced milieu teaching for parents?
Enhanced milieu teaching for parents, yes. So, I mean, that's basically what the foundation of our research was, is teaching parents how to grow their children's language through that enhanced milieu teaching. So my thoughts on it are, I love it. And anytime you can study it, I think it would be meaningful to you as an educator. So the Pee Wee Project, the Kid Talk Project, which is from Vanderbilt University, those use those EMT strategies, and also the research that Dr. Lee and I did on Toddler Talk. It shows the EMT strategies as well. So that's much of what I use in my daily therapeutic practice includes those strategies, and it's fun. So you do have to really understand child development and be an expert at what you're doing so that you can teach the parents how to do that. And it's a pretty effective strategy.
Your experience is relevant to AAC or AT for young children with speech/language delays.
This is great. So young children with speech language delays and augmentative alternative communication or assistive technology. I am one of the few people in Central Illinois who do augmentative communication evaluations for young children, and really young, like 2-year-olds. And so my experiences is anywhere from using pictures to help them start to communicate to using like this little girl I told you about who uses eye gaze, and she's only 2 years old. If we know a child's going to need augmentative communication, it's great to get them started as early as possible because that's going to be their language system. We need to start modeling on it even if they can't use it. So just like we talk to a child for a full year when they're an infant before we ever expect them to say their first word, if we have a child who's going to be an AAC user, we need to talk to them for a long time using their communication system before we can expect them to start using their own communication system. So as early as we can get that child started, how do you know if that child at 2 is just speech delay and just need some more time, or if they're actually going to be somebody who needs a communication system. That's a bit of a lengthy discussion that I'd be happy to talk to you about if you're interested in more in depth. But there is a time and place to get started, kids started that young, and it's amazing what they can do with it.
What's the most rewarding aspect of your work?
Mm, that's so hard. Um, I mean, I just love working with the kids. So to me, what's rewarding is just being around the kids, especially now as I haven't been able to be around the kids because we're in quarantine. It's been really hard, and so they're just my little buddies, and they trust me, and they teach me a lot, and they bring me a lot of joy, and so that's the most rewarding part of my job. The next most rewarding part of my job is making relationships with families, and so our therapy here at Child's Nature is very family focused. We always make sure that we're prioritizing the family's needs and goals, and we create a really long term relationship with them based on the needs of their child. Um, and that's incredibly rewarding and humbling to be let into somebody's world like that. They trust us, and they count on us, and in turn, we get a lot from them too because they offer us a lot by sharing their kids with us, and I really appreciate that. I think that's the most rewarding part of my job. It's also super rewarding when you work through a really hard case, and then there are moments where you just don't even know how to get through a single session, let alone what your plan is going to be for the child. And then hindsight, looking back a year or two later, the child says their first word. I have a little guy who's 10 years old, and I've been working with him since he was 6, and got him a communication device. And it wasn't until he turned 10 that he started making his first vocal imitations, and now he's starting to talk. So that was 4 years of working with augmentative communication. He was already 6 by then, so for the parent much longer than that. But for me as a therapist, there were times that you just didn't know where it was going to end up, and to be able to hit that point, even if it's 4 years later, where wow, this kid just said mom, he just made a sentence, he's using his actual voice. That's incredible. So those are some really rewarding parts too.
What is the most challenging aspect of your work or aspects?
The most challenging aspect of my work by far is the advocacy. So I have become a trained advocate and go to IEP meetings with families to help create a strong, individualized education plan that's really going to be meaningful for their child. And that is hard, 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 because by the time I'm called in as an advocate, things are pretty adversarial at that point, and people are pretty unhappy, and things haven't been going well for a long time. And so people are heated. I'm usually a little heated because by the time I take a look at things, it's not going well, and I want things to be going better. My ultimate goal is to create a strong IEP plan, help facilitate that between the parents and the team on behalf of the child, so that we can start to make progress. But sometimes there's a fight involved in that before you can get through and break through to write a good plan and then start to make progress. And it's that fight, that adversity, that is a real struggle for me. So those things are really draining, but so important, because we can't make progress on a child if we don't have a strong IEP, and if we're not using strong evidence-based practices and strategies that with data show progress on the goals for these kids. And so it's a long, long haul to come in when things are not going well and try to break it down, start over, and build something strong. And I'm often not liked because I'm coming in there being like, okay, things aren't, my role as an advocate is to challenge what's going on and kind of bring to the front the things that people are not happy about, and advocate for doing something more and better. And that's a tough position to be in, but ultimately I keep doing it because there's a big need for it. So that's the hardest part of my job.
Being the director of an EI agency, Why is EI important for the child's language or speech development?
So early intervention is where we can make the biggest impact. I think the reason, there's two reasons early intervention is so helpful. The first reason early intervention is so helpful is just simply the age. Kids who are under the age of 3, they're predestined to make rapid progress, and if things are not going right, they've got such a they've got such great neuroplasticity that we can start laying down neural pathways in their little brains left and right, through not all that many repetitions of a certain skill or task, and then we can wire that and move on and make really rapid progress. So simply by the nature of their young age and their very formative minds, we can make a lot of progress quickly. If we wait until later and those neural pathways are already laid down and now we have to go and rework them and teach them a new way, that takes a lot longer. The other great thing about early intervention is it is parent family focused. If Dr. Lee has talked to you about the individualized family service plan, it's focused on the family's needs. And when the family is invested and you're teaching the family using those enhanced milieu teaching strategies, then and using parent coaching, you're going to make great, meaningful progress. And if we do that, we can get a child to kindergarten. By the time they get to kindergarten, they're already caught up, as opposed to a child coming into kindergarten who's never had those services, and now it's going to take us years to undo and redo the work that needs to be done. So early intervention is an effective program. It's very rewarding in that you get to work with 2-year-olds, and I don't know about you, but I love working with 2-year-olds. Bring them to me. You get to go into the families' homes and see so many different dynamics and so many different social and cultural situations that it's just very rewarding. And the kids make progress through early intervention, so that's why it's so important.
If a young child doesn't speak at all before the age of 2, what should be done to help them?
Okay, so before the age of 2 is a little vague. We want to see kids saying some words. The first word generally appears between like 12 and 15 months. That would be typically appropriate. And then by 18 months, we want to see kind of a handful of words. We want to see them starting to understand things. There's progress being made. They're exploring new sounds. By the time we get to 2 years old, we should be starting to put together 2 words, right? So 2 years of age, 2 words being put together. A lot of pediatricians kind of brush it off and tell the parents, oh, he's fine. And maybe he's just going to be a late talker. It's possible. Maybe he's just going to be a late talker. But again, if we get him referred to early intervention and we do an assessment and find that the child is delayed, those early intervention services are going to make much more rapid progress than if we do wait. And sometimes we flag some other issues as well while we're in the process of just kind of, maybe our first concern was speech language, but now we notice there's also some fine motor or sensory concerns. So it's always good to make a referral. If there isn't a delay, we can just say, we can check back in 6 months, or nothing to be worried about. You're doing a great job. Here are some strategies. Make sure you read books every day, right? That's always what I leave saying. But it's okay to make a referral before the age of 2, and sometimes it's appropriate to make a referral before the age of 2. I've done speech language referrals for as young as 1 year because I knew by looking at the child and the child's family history that there's probably some concerns here. And so that's okay if you have concerns and refer early. There are times when that's appropriate under the age of 2.
What are some of the red flag signs that may adversely affect your child's speech or language development, and the steps that can be taken?
You missed a question.
No, I didn't.
What about the first part?
The first part is
We
just
learned that there's
expanding
such-
off of it.
Okay.
And it was wordy.
What are some of the red flag signs that may adversely affect children's speech language development? Adversely affect. So maybe what you're asking me is like, how do we know that a child's speech language development is delayed? I think is might be when are we going to be concerned about that? Um, if the child isn't making progress over time, so say like several months go by and we're still in the same spot we were a few months ago, especially for a child between the ages of 1 and 2, that's a time to be concerned. Um, if the child isn't exploring different sounds, if the child is not understanding new words and showing you they understand, so like, where are your shoes? And they go get their shoes, or show me your body parts, eyes, nose, ears, mouth. If they're not starting to learn things like that, then we might need to be concerned. Open mouth posture, tongue out, drooling, low tone, not exploring a whole lot of sounds, that might be a time to be concerned. Any of those flags associated with the autism, so like lack of eye contact, repetitive stereotypical movements, lack of interest in other people or relationships, wanting to play alone. Also, attention concerns, so not sitting and looking at books, not expanding their play in a lot of ways. The play skills are a huge red flag for any type of language development, because before we learn language, we learn play. So if we're doing a lot of repetitive play and always wanting to play the same thing in the same way, that would be a red flag. Oh gosh, those are the things that come to me off the top of my head. So
What would your advice be to those interested in also pursuing speech therapy as a future career?
I would say find somebody you can shadow if you're interested in that. So, speech therapy is a really wide field. Even though it's so specialized, it's just very wide and large in terms of what direction you can go into. You can do pediatrics, you can do adults, you can do school, you can do nursing homes, you can do speech sound disorders only, you can do language development only, you can do like me and specialize in augmentative alternative communication, you could do very young children like early intervention, you could do hospital based neonatal preemies, or children who are more exposed to drugs in utero and so they have some developmental speech language concerns that way. You could focus on traumatic brain injury, acquired injuries. So you can focus on swallowing disorders and feeding. So it's huge. And so kind of just getting your feet wet, seeing who you can shadow, maybe taking a speech language development class as an elective. Those are all ways to kind of explore more what you'd be interested in and maybe listening to somebody be interviewed like me.
All right.
All right. So those are all your questions. I hope they're helpful, and good luck to all of you guys in your final weeks at school. Let me know if you have any questions. You can email me. Dr. Lee has my contact. Take care.